You're welcome back to the Pulse on the Joy News channel on Malta TV. Now, the Ghana Association of Medical Laboratory Scientists say it has no intention of returning to work till government provides a roadmap to the launch of the National Laboratory Policy, which has been on the shelf since 2013. The association started a nationwide strike today to press on their demands for the policy to be launched by the Health Ministry. Addressing a news conference, the association's president, Ignatius Awinibono, blamed the disinterest on the part of the Health Ministry as the cause of the delay in the launch of the policy. We'll hear from him in just a moment. But Joseph Akable, my colleague, covered the news conference for us. He joins me in the studio. Good afternoon to you, Joseph. So today, when they held this news conference, do we know whether or not all their members across the country have withdrawn their services?
Well, the press conference actually marked the start of the strike action. So at that particular point, they are saying that across the country, none of their workers can be found in any of the laboratories, apart from services that relate to the blood bank. They've withdrawn all services across the country. So what it means is that if you visit a laboratory now and you are supposed to undertake a test before a doctor can treat you, that test cannot be undertaken.
And these are for public hospitals?
They have the support of the private hospitals, but they are yet to join the strike officially. As it stands, it's just the public hospitals across the country that they've withdrawn their services. And they are talking about the national policy for labs. And they are saying that since 2013, they had consultation with the Ministry of Health, and that led to a drafting of the document. The document is ready, but the ministry is being hesitant in launching the policy. They are saying that there are challenges with the service provision. That policy will address challenges of who qualifies to be a lab scientist. Then again, in terms of lab finances, who should manage it? It also gives them a representation on the management board of the various hospitals that can help them advance challenges facing them. And they feel that once that is not being passed, it affects service delivery. So they want government to launch a policy.
Let's hear from Mr. Awinibono then.
Let our cherished clients and general public know that they are our primary concern for embarking on this strike, since the implementation of these signed documents will ensure accessible, affordable, accurate, reliable, and safe medical laboratory services in our country. We share the common pain and frustration with them when they are unable to access quality laboratory services because of inconsistent supply of quality controls, inconsistent supply of functional equipment, shortages of reagents needed for our work, the unqualified personnel that work on your samples and your tests, and situations where patients have to carry samples abroad for testing when these can be done in Ghana here. We have heard your plea, and we are now taking the right steps to halt further worsening of the situation. We are equally frustrated, and we are together with our clients in these difficult times, and have only been compelled to resort to this unpleasant approach of withdrawing our services because the Ministry of Health has failed to give life, to live up to its responsibility. These policies, when implemented, will set the stage for improving quality care in Ghana to international standards, and will save our medical laboratory services and healthcare delivery in this country from imminent collapse. Prevention is better than cure, and posterity will never forgive us as professionals, clients, and as a nation if that happens. Hence the need to speak out and act now before it is too late. We need to avert a looming disaster. Our actions today will save this nation a higher number of preventable deaths, morbidity, and inefficient utilization of the nation's resources tomorrow. We ourselves, our families, our friends will equally need medical laboratory services during this period of service withdrawal, and do not see it as pleasant, but have been pushed to this stage by the indifference of the Ministry of Health. To our gallant members of the profession, I want to encourage you to keep the flag flying. I want to encourage you and let you know that you need to be fully part of this strike. I want to let you know that what we are fighting for is for the change and the deliverance of our profession from oppression. even though we are currently being poorly paid by the same ministry, to the extent that we take close to 80% of what our analogous colleagues take. This is not even the matter that we are striking about. What we are striking about is central to the development of healthcare delivery in Ghana. So we are not parochial in our interests. We are either looking at the general good of our populace.
Right, so that's the president of the Medical Laboratory Scientists Association, Mr. Winnie Bono there, addressing that news conference. Joseph is still with me in the studio. Joseph, one thing you mentioned is about the private hospitals and the support that they have for this action being taken by the association. When they say they are in support, what does that mean? The
president of their association, Dr. Mark Odum, he was present at the press conference in solidarity with them, and they are saying that they may be joining the strike quite soon. But as it stands, they are yet to begin the strike action. They are saying that they agree with the demands that they are making because they have the view that once the policy is launched, it will provide a framework that will guide the profession, not just in the public sector, but in the private sector as well.
Okay, so what would this mean for anyone who's going to a hospital and needs medical attention at, say, Kolebu or at any private medical facility?
Now, what it will mean is that, I mean, if the doctor wants to attend to you and the doctor says you require some test in a laboratory, you'll have to go to the lab. You have to go to the lab first for those tests. Now, when you go to the lab, there's no one in the lab assistance. Unless it's an emergency situation that needs blood, that you need to go to the blood bank. In those instances, you can get access to blood from the blood bank. But if not for such services, so like you want to check your blood group or other tests that you need to carry, you will not have access to the lab.
Okay, thank you, Joseph, for those details. Now, journalist said Kwame Boateng has returned from his one-month visit to the United States of America with some good news for prisons across the country. Seth was part of an international human rights training program organized by the Fordham University Law School. His latest documentary on the state of Ghana's prisons, Left to Rot, was also premiered as part of efforts to generate support for the Ghana Prison Service. Seth Kwame Boateng will join me shortly to understand what exactly the support he's brought us from the United States will mean for the Ghana Prison Service. We'll have that after the short break. Stay with us.